Hello, my name is Angel Washington, and I am here to discuss prescription drug abuse. The name of the class I am in is called Community and Public Health, which is HCA 415. The instructor is Mrs. Brandy Benton, and I have a submission date for today, which is December the 17th, 2018. The public health issue that I would like to discuss today is called prescription drug abuse. Before we get into the details of implementing a policy, first I would like to discuss what prescription drug abuse is. Prescription drug abuse is when people misuse prescriptions that have been prescribed for health and other medical concerns. It is when prescriptions are used in a way that was not intended by the prescribed doctor. Prescription drug abuse affects all ages and now includes teenagers. Teenagers have had a high rate over the past few years abusing prescriptions that have been prescribed for either themselves or other people and frequently use the prescriptions to sell on the street as a way to make money. The impact that this has had on our community is significant and has had an increase over time due to the availability for prescriptions now outside of physician offices. Some of the prescribed drugs that are often abused include opioid painkillers, anxiety medications, sedatives, and stimulants. Prescription drug abuse needs to be addressed and taken seriously because we continue to have more people each year who are not only affected by this drug, but they have also lost their lives over this. The National Institute of Drug Abuse states that more than 72,000 people died of a drug overdose due to prescription drug abuse in the year of 2017. The policy that I am proposing includes having a drug overdose list of prescriptions that are often abused, most common drugs, as well as having educational classes given to each person that is prescribed any medication that is listed on this drug abuse list. This would also include having the pharmacy work closely when patients have drugs on the prescribed list that have been prescribed within 30 or 60 days by another physician and that is requesting a refill. Now, before we move on, let me discuss what this means. Often in the healthcare field, there are patients who are known as frequent flyers. What these patients tend to do is they go from hospital to hospital or physician office to physician office requesting treatment so that they are able to get the prescribed drug medication that they need. When they are no longer able to do this at an office because of the doctor catching on to what they are doing, the patient tends to go to another office so that they can get those needs met. This is what is known as prescription drug abuse. And it also leads to patients being addicted. Having the pharmacy involved in this will ensure that patients are aware of how medications should work when they are used directly by the doctor. So, if we have the physician, the pharmacy, and the patient all on the same page, we are more able to streamline a process to ensure that prescription drug abuse is decreased. This will also cover having educational classes. So when these classes are given, whether it be at a physician office or a hospital, patients are aware of how the drug can affect your body when misused. Oftentimes, when patients are prescribed medications, they are given the side effects of what can happen if you misuse the drug, or what kind of side effects it can have on your body, but we don't really tend to talk about overly using the medication, how it can have an effect on you. And I feel this is very important. Along with having this policy put in place, I would also make sure that refills are not given to patients without a routine follow-up appointment. Routine appointments are very important because it not only gives the patient a time to speak back with the doctor, but it also gives the doctor to re-examine the patient to see if the same dosage or if the same drug is needed that was prescribed before. Doing this will eliminate all populations that are being affected by this, because now we have data to use, and we also can see the trend in prescription drug abuse. This policy will help address the issues by data being able to be tracked on each patient. It will also allow for data to be kept on drugs that are prescribed the most, and with what diagnosis it is more possible to get refills easily. Implementing the above policy will have a change on the populations affected, as well as decrease with the number of drugs prescribed that contribute towards drug abuse. Reviewing the details of this policy will have no initial costs for physicians. However, patients may experience additional costs. Some of the costs included with the patient may include a follow-up appointment, so they would have to pay for another doctor visit, as well as the prescribed medication. Some of the risks associated with not having this policy in effect include an increase in patients' experienced drug abuse. This will be due to prescriptions not being monitored closely. If this policy is approved and put into place, then the amount of frequent flyer patients that are seen will decrease. This will be due to the pharmacies alerting physicians on recent refills on file for a drug on the list from another location. After doing this research, I do feel that there is no real way to stop prescription drug abuse. However, I do feel that there is a way to better streamline this process, and there is a way for this to be more controlled than it is right now, so that it is not as easy for people to have access and become addicted to these drugs. I also feel that when we do encounter those patients that do experience prescription drug abuse, then we need to offer counseling and make sure that they go to classes that they must complete, understanding how prescription drug abuse affects themselves and others around them. Taking these classes would be mandatory, as well as have them to understand the importance of this. While taking classes, they are also made aware that they are not able to misuse the prescription of drugs prescribed by a physician. I hope you enjoyed my policy research on prescription drug abuse, and I thank you for your time.